welcome to the segment. I'm joined with two amazing individuals from a great organization. I decided to wear my shirt today because I wanted to represent NAMI today because it has been an amazing organization that I have been a part of since 2019. I want to say right before the pandemic, we did a lot of work with the different initiatives like the Ending the Silence, the In Their Own Voices, speaking at schools, community centers, churches, police districts, and it has been a raising organization for me that I so much that I was doing that work with them that I started to become a part of it, joining the board and different initiatives in that way. But it's not about me. You all know me. I want to introduce these amazing individuals because they are here to talk about a book that NAMI has. Hold on, I gotta show it to y'all for those who are watching on YouTube. It's on Amazon right now. It's called "You Are Not Alone." Hold on, the self is it? Oh, the NAMI Guide to Navigating Mental Health with advice from experts and wisdom from real people and family. So I'm gonna stop talking and let's start with Tara, ladies first as always, and then we're going to move to Dr. Ken. Introduce yourself to the people. I don't never give introductions because I want everybody to get their everything they worked hard for. Let them know why they should be listening. Please let the people know who you are and what you do on a day to day.
All right. Well, thank you. I'm happy to be, a part of the show today. My name is Tera Carter. I am a certified peer specialist here in the great state of Georgia. I'm in the Atlanta area. I'm a certified peer specialist. For those of you who are not aware, we are trained to work in the mental health field. But what makes us unique is that we have our own lived experience with a mental health diagnosis. And so I received a diagnosis back in 2013 after having my own crisis, and then decided to go into the field late in 2019 and got my certification then. I have been working with NAMI for a very long time, about 6 years now. But professionally, I am a second responder on the mobile crisis team here in Georgia, which is now 988. 988 launched back in July, and so I am part of a group of people who go out personally to respond to individuals that are in a mental health and substance abuse crisis in our community. And then I also work full time as a CPS at Skyland Trail, which is a residential mental health facility. Here I lead different groups on the campus, but I also do sessions with our clients that support what they are getting with their LPCs, with their therapists. And so I enjoy doing that. I also oversee the alumni here on the campus as well. I'm the alumni coordinator. And so, I have had a great experience so far in the mental health field. I actually come from the music industry, and after having my crisis, just decided that it was not an industry that was going to be great for me to be able to stay well. So I'm very passionate about what I do, especially, for my people. I think that there's a lot that we can do to help educate those that are in the Black community about mental illness. I think that a lot of our people do struggle in silence because of the large stigma that we have. And a lot of it is just due to a lack of understanding about what brain health is, and how it works. And, just being able to understand that, it is something that could be managed. Sometimes it does require treatment, and treatment is okay. But what does treatment look like? And so that's kind of one of the things that, I really am passionate about doing, whether it's in colleges, whether it's in a treatment facility, schools. I do a lot of work with the CIT training with law enforcement. So, I'm just all game for advocating for mental health and trying to eradicate stigma as much as possible.
Thank you for that. And Dr. Ken, I see your name everywhere on emails and stuff that I get from NAMI Communication. So please introduce yourself to the people formally so they can get to know about a little bit who you
Well,
are.
thank you. So my name is Ken Duckworth. I'm a psychiatrist. I'm boarded in adult and child and adolescent psychiatry. I've been NAMI's doc for years, and I always felt NAMI should have a book, and I wanted the book to be different. So Tera and 129 other people share what they've learned. about their journey, about their experiences of the culture they live in, and how they're trying to change it. So this book, You Are Not Alone, hit the USA Today bestseller list. Like, it's been a great experience for us because I believe we have neglected lived experience as expertise. I'm not against research expertise. I like research. But if you've lived with bipolar disorder for 20 years, you've actually learned something. And I think we've kind of left that wisdom off the playing field. So that's the idea of the book. Real people use their names to break down the isolation and shame that is so common in the mental health space. People like you. It's a very diverse group of people. 11 different self-identified race and ethnicities, 38 different states, age 16 to 100. One woman said she was old as dirt, Reginald. So it might be over 100, but that was her answer to that question. So I think what you realize is there's somebody like you in this book who's going through something like what you're going through. Tera was a delight to meet, to interview, to learn from. And I tried, to make sure that I asked people, would this quote be okay with you? And everybody, approved their quotes. But the truth is, in a 400-page book, I had to cut probably another 400 pages of amazing quotes. Like, there could be a whole second book with wisdom from real people. So it was a great privilege to write the book. NAMI has the copyright. All the proceeds go to NAMI. All the royalties go to NAMI. So, this is a community project where we all own it and we're all paying it forward. But thank you for having us today.
No, I appreciate that. And Dr. King, you speak on something. I'm gonna go to Tara. But you spoke on neglecting lived experience as expertise. And Tara, we talked off air about how we share similar journeys in the mental health space. You become a certified peer specialist, and then working in a crisis center. I want to get into that later, but um, that's being a certified peer specialist, from my experience, it's still not as respected as it should be in the industry, when it comes to like dealing with patients and individuals who have mental illness or mental struggles. Can you talk about that in your experience of and how we can become more solidified as a healthy community if we start, respecting certified peer specialists and lived experience as an expertise?
Yeah, most definitely. Here at Skyland, it's a nationally renowned facility. And so, one of the things that, was brought up in coming here was, well, you're a CPS, you're not licensed, they may not, respect what you have to say as much as, a licensed, clinician. And, for me, that's like a challenge. I feel like the more we have certified peer specialists that come with passion, but not just passion, but also come with a great sense of the workspace that they're in. I think it's important for us to be knowledgeable, for us to be knowledgeable, for individuals around us to see that no, I just don't have this certification. I do know what I'm talking about. And for them to see that, I think for me, I put a lot of emphasis on the work that I do with our clients because the clients are going to be the ones that go back and talk. It's kind of like the word of mouth marketing type of situation. That's really kind of how I see it. And so when clients go back to their PCs and talk about how well our sessions were and how, we talked about this or that and how it, helped change their life, that speaks volumes to, the work that we do as a CPS. And so I think that, we have to go into situations, knowing that there may be some reluctance, on, what we know. We may not have, all the schooling that a licensed, LPC might have. But at the same time, what we do bring to the table is valuable. And I do believe that it's on us to be able to show that. And so I think it does take time, but I've seen in both of the communities that I've worked in on the mobile crisis team and in the treatment facility that I have been very well respected. But I think that again, it is because I knew that I just couldn't come in halfway. I had to make sure that I was on my stuff. I try to pride myself on keeping up with what's going on within the community as it relates to research. anything new that's going on with mental health, I try to keep up with those things as well. And I believe in being a consistent learner, and so I think that, as CPSs, we have to take that part of it seriously, that people will have doubts, but, we can change their perception by doing great work.
That's phenomenal. Dr. Ken, I know you came off mute. Did you want to add to that?
Yeah, just how great it is that the movement of peer specialists is increasingly recognized. It's not either or. Don't think either or. It's not psychologist or clinical peer specialist. It should be both and. Each of them have probably picked up different things in their experience and training. And our services are richer and better if we use all the people who have something to bring to the table. And that's the beauty of the book, right? The lived experience is powerful. And for some reason, nobody had ever thought to pick that up.
Now, and I wanted to stay there too, Dr. Ken, because we speak on, or for the passages that I did get to read from the book or pull from the book, we're talking about different pathways to recovery. And I think when we talk about certified peer specialists, that's a pathway. Support groups are a pathway. Going to therapy is a pathway. But from a medical professional and a medical standpoint, um, so I work for an organization called Black Men Hill, and we provide free therapy to men of color. And one of the things our executive director talks about is how the mental health system was already overwhelmed, and then you got the pandemic that added to that overwhelmness of the system, and so there is not enough service to meet the demand. In your medical opinion, what do you think about that when we talk about different pathways to recovery, and then how we can't even meet the demand of everyone that's in a quote unquote crisis?
Demand is crushing supply. So it took 8 weeks to make a mental health crisis in COVID on top of the previous mental health crisis. It takes 8 years to make a social worker. So supply is never going to keep up if all you think about, the only people are licensed professionals. So peer specialists add to the portfolio, and I think they extend the capacity of the licensed people. So supply is not keeping up with demand, but bringing licensed peer specialists, certified peer specialists into the game is a way to make a difference. It does not replace. They're not doing diagnosis. They're not prescribing medications, right? But they have something to offer. Most professionals don't have to offer. And so this is kind of the both and way of thinking that I like to approach this entire question.
No, thank you for that. And Tara, going back to that, when we're talking about the crisis part of these different initiatives, and thinking about, well, actually, no, I want to get this question off because you said it in the beginning. I'm like, we got to record it because I want to get your raw reaction to it. The difference between working at a crisis center versus the clinical perspective. Talk about, because you're in that unique position. Talk about that experience.
Oh, absolutely. I want to say that, I enjoy both sides, which is why I still do both sides. I think in a crisis setting, the difference is, you're going out in the community and you're meeting, you are going to assess risk, you're going out in the field, you're trying to determine whether or not it's safe for this particular individual to stay in the community, and if it is safe, what resources can we help this individual with to get them on the right track? If it's not safe, then how do we get them into the hospital to get the treatment that they need to stabilize them? The thing that I felt like I was missing being in crisis work is that I'm highly relational, and so it was hurtful for me to go in and see a situation where I knew the individual was going to need a lot of support to get to a place of recovery. But when we left the scene, there was no more contact we can have with that person. So there was no follow up from us. There was follow up from the organization, but the follow up couldn't happen from the actual team that went and met with the individual. And so, crisis is really assessing risk and meeting the demand for that time, that specific time, and that particular day. In a treatment facility, the difference is that I'm seeing clients come in at their worst, and I'm being able to walk with them as they get into a place of recovery. the average stay here at Skyland is 3 months. So I might start meeting with someone when they're 3 or 4 weeks in, and then for 2 months, I'm having sessions with them. So it allows a different array of response and treatment to the individual. It allows me to get to know the person personally and kind of see what some of the things are that they struggle with, what some of their triggers are, so that we can work together and come up with a plan on how to attack that. We're able to deal with core beliefs. So it's more of when you're in a treatment facility, it's more of a well-rounded um, situation where you're attacking, the needs of the individual holistically. In crisis work, you're just trying to meet the immediate need and assess the risk of whether or not the person is safe enough to be, in the community. And if they're not, how can we get them to a place where they can get stable again? And then after that, it's over. And so, I think that I like being on the crisis team because here in the Atlanta metro area, most of the calls are our people, are my people. They're Black people. And I know with the level of stigma that comes along with mental health in our community, that there is a better response when someone is coming to your house or coming to your school or coming to your job that looks like you, and especially for Black men. I will say that, especially for Black men. And so that's part of the reason why I stay on the team, is that I know that we can reach more of our people in a better way if we go out and we're meeting with them individually when they're in a crisis. Um, and so I think that that's what I appreciate about the crisis work. On the treatment side, I really appreciate the ability to have genuine connection, with the client, and being able to build relationships and being able to, really deal with, the things that they're struggling with holistically, and be able to work with them in order to attack those things, and kind of help them get to where they into an area where they need to be. So, that's kind of the dual role of each side. And I enjoy both, but they are very different.
Dr. King, you had anything you wanted to add to that?
Isn't it wonderful that Tera is a peer
I
specialist?
was going to say, Dr. King, they got to
Isn't
put
it
some
just
respect on
fantastic?
the
And
peer specialist name.
how blessed I was to come upon her. The workforce is not diverse enough. Most people look like me in the mental health workspace, right? I'm a white guy from Michigan. And, that doesn't necessarily convey a sense of that I'm going to understand culture. I really listen. I try to really be humble. I try to let people teach me. But there's all kinds of historical and institutional problems around race, right, that may prevent somebody from sharing their experience with someone like me. So as much diversity as we can bring to the workforce, and peer specialists are a key piece of the workforce, it's just a great blessing, because people might see Tera and say, I can share something with her that matters. Right. So I just think it's fantastic that Tera exists, that people like Tera are doing this work, and that I found her for our little book, because one of her great quotes, she had a dozen great quotes, is, she meets somebody in crisis as the second responder. They say they've lost everything, and she waits till the right moment. It's not about Tera. It's about helping the person, and says, I was in your shoes a couple of years back. I had lost everything. You're going to have to work hard, but I'm here. I'm living proof that you can move ahead in your life. And Tera, you had a dozen great quotes, but I loved that quote. Your work as a peer specialist on a crisis team, because I wanted it to teach people that this is an idea that can happen. Georgia is ahead of most states. My home state of Massachusetts, is not a leader in peer specialist work like Georgia. So I'm just grateful, that Tera was willing to be part of the book, because I felt like what she's doing is an important way to teach other people.
We're speaking to Tera Carter and Dr. Ken Duckworth from You Are Not Alone, the NAMI's book on the guide for navigating mental health, and getting advice from experts and wisdom from real people and real families. So again, I joined NAMI in 2019, right? And one of the things, and this is a question for both of you, and I would love for Dr. Ken to answer it first. One of the things I realized, I'm like, this organization, this great organization has been around for so many years, but why hasn't it permeate into my community? You get what I mean? Why didn't I know about it? Again, Tara was doing work already, and I should have known of it because it was like, I'm doing that work, but I didn't know about it until a friend of a friend recommended it to me, right? Because they knew I wanted to get into the mental health space. So it was almost like I had to find mental health, and then I
Mm,
found NAMI instead
yes.
of NAMI finding me. And again, I don't know where that barrier is, but I felt like because of all the great support groups and resources, it should have been able to permeate and get into my space. To that, both of you say what?
First of all, I think NAMI's still the best kept secret in America.
Mhm.
And one of the reasons I wanted to have a book was to create the conditions where a person could say, in your local library, in your local bookstore, this is a resource. You can find out all about family to family, peer to peer, ending the silence, all the NAMI programs from real people. And I think that I've had so many people say to me, God, only if I knew about NAMI 10 years ago. This is what people say to me. And I thought, I'm going to write this book. Then, of course, one of the first Amazon reviews is, I wish I had this book 9 years ago. So I think we're still catching up. But I think also, NAMI has had to figure out how to connect with communities of color. We have a CEO who identifies as Black. We have some amazing people on our JEDI team, Justice, Equity, Diversion, and Inclusion. I think we're trying to do a better job overall. But I would say your experience is not unique because I've met plenty of people from the majority culture who would say, I don't know what NAMI is, but here I've been struggling with this thing in my family for 15 years. Why didn't anybody tell me about it? So it's a challenge writ large, big challenge. And then I think within specific communities, we also have work to do. Juno Pitchford is leading an effort with the historically Black colleges and universities. So we're trying to get ahead of it with the next generation. So it's an interesting question, though, and how much of it is the inability to connect with this culture, and how about if it just NAMI's being all these free programs are still a secret? I can't really weigh that for you.
And before Tara goes, I want to say, like, I'm in the peer-to-peer support group. I'm a facilitator. I rock the NAMI shirts. Like, I'm on the board. Like, I'm trying to do my part so that way it can, permeate and utilize it. But again, Tara, I want to get the floor over to you to just speak on your experience because, again, you're in there, certified peer specialist on the ground doing that type of work, but it's still, like, again, not a unique experience in a sense.
Yeah, I do think that, there's still, a lot of work that can be done in, getting the exposure needed to NAMI and, our community. But I think that requires us to be intentional about bringing NAMI into certain spaces. So an example of that would be, a couple of years ago, we got a call from the counseling department at Spelman College, and they were overwhelmed by the amount of young ladies that were coming in, and they felt like maybe if they started a support group on the campus that might be helpful. And so when we came on that campus for that year, none of those young ladies that attended support group had ever heard about NAMI, and so I think that being intentional about either having support groups or doing in our own voices in certain colleges. I'm really a big advocate on hitting the Black churches. Last month, I was at my own church. We had a women's conference, and we had a mental health component, and I talked about NAMI. I think we have to be strategic in reaching our people, and so that they can be aware of what resources they have available to them, because most of the time they are not aware. I don't know how many times I've had, individuals who are like, they don't know the difference between a psychiatrist and a psychologist, and how to go about choosing one. So I do take it as something, that we have to be intentional about as it relates to exposing our community to the resources that are available to them. We have to be willing to go into those certain spaces. We've done peer-to-peer classes, Reginald, in Black churches. We've done these, peer-to-peer classes, on campuses, college campuses. Doing those type of things helps bring, the awareness that's needed. But we have to keep doing it. I think, like Ken said, that we're preparing the next generation. to be able to be resourceful, and be able to, use their resources that, are out there in order to help them in either managing their own mental health or, their family members, but it does require us being intentional about going into those spaces and being able to expose in that way.
No, I appreciate that a lot. And Dr. Ken, I'm going to put the ask on air for getting the CEO Dan on the platform to speak about it. I got to put the ask out there. They say if you don't ask, you don't try.
He's fantastic.
I would love to get him on the podcast
Of
and just
course.
having a conversation. So I'm putting the ask out to you.
Yes, of course. Dan is wonderful.
Um, there's something you mentioned, Dr. Ken, that I wanted to get your perspective on because I heard you mention it. You said culture. And then we see in the book the intersection of culture and mental health. And then I seen another passage of like broadening definitions of culture. Just your perspective, your opinion, your viewpoint on culture and what that all means and encompasses of the book You Are Not Alone.
Yeah, so in listening to 130 people, it became quite clear to me how people experience mental health. Their culture is part of that experience. I interviewed a family in the evangelical church, Pentecostal church, which, their son was struggling hearing voices and they were told to lay on of hands. That was not a Black mental health experience, but it was an experience that I thought was really important culturally. I interviewed several women who are trying to live their truth and also have their faith in the Black Southern churches. So it was impossible to miss. So I'm interested in culture and how people experience, but if you grew up in Japan and you can't talk about mental health, or you grow up as a white male in a fraternity and can't seek help for mental health, right? Those are all interesting perspectives. And these were all different people who said to me, there's a lot of shame and isolation in our community. What was noteworthy to me, Reginald, is it was in many communities, the Black community, the Asian community, the Latin American community, right? The male community, the white male community. Like now you're starting to get into a substantial subset of subcultures that make it harder to seek help than it should be. Mental health conditions are universal. They don't discriminate. And somehow some cultures have, worked against people having the help and getting the help that they need. And I think that's what the message was in the book. Everybody in the book did this to help other people. Like the whole thing is a giant paying it forward project. Like they're sharing their stories and using their names to help another person get there quicker. They don't have to wait a decade to find out about NAMI. They don't have to wait 5 years to get help. Somebody like them in the book, is doing better.
Did you want to add to that, Tara? As far as like culture, broaden the definitions of culture and things of that nature? You're on mute.
I'm sorry, I was trying to get it off. I started talking before it was off. I just, the only thing that I would add to it or, would say is that, culture does play a big part. And I think one of the things that I've learned being on the clinical side of things is that, there's a way for us to maneuver culture and treatment without being disrespectful to culture. I think that we have to be mindful, we have to be respectful. I am a woman of faith myself, but I make sure that I communicate that, me going to get treatment is not my lack of faith, I'm an asthmatic. If I'm having an asthma attack, nobody's going to tell me to pray uh, until I start breathing better. They're not going to say that. They're going to say, go get help. And so one of the things that I share is, you know what? You can pray. We can pray. Faith without works is dead. So we pray. And the work is we go get help. You know what I'm saying? So I think it's kind of sometimes we get fixated on certain things, not seeing necessarily that it's not just one way. We can do things and it can be a healthier situation. And it doesn't necessarily denounce our faith or is a put down to our faith as it relates to, spiritual matters. And I think, culturally, I've had so many different clients, that come from different cultures. And sometimes it is a challenge because, in their culture, they may not discuss mental health at all. And so then it becomes a situation to where, okay, how do you want to move forward with this? You may not be able to share with your family or your parents about your mental health condition. Well, how do you create a new network or a new support system, of individuals that you may be able to share with? You may not be able to do that with your family, and you have to accept that. But there's always opportunity for us to be able to extend our network beyond our family members so that we still have a safe place to be able to share with. So I'm all about, being respectful and providing solutions that help us work around some of the cultural boundaries that we have.
Yeah, and one thing I will say, just hearing both of you speak is, and then just doing personal experience, a lot of things that individual identify as culture can be traumatizing as a man, as a black man, just in general, like different cultures that make you can be a Caribbean man, just different things that growing up in the Caribbean or growing up in a family that's from the Caribbean and how that plays a part. It can be traumatic. So I thank both of you for that. I actually wanted to move into, again, we're talking to Tera Carter and Dr. Kim Duckworth from You Are Not Alone. Let me make sure I share because I was trying to see what people were talking about on the book, man. I wanted to see it on Amazon. Make sure y'all leave a review for anybody that did get it, and
If
our
you
list.
love it, leave a review. If you don't like it, go on vacation. Take a break.
Please leave a review. And it say if you read this book, from some of the comments, if you read this book, you cannot feel alone, unique, hopeful, and an essential guide. So, please check it out. Especially again, if you love it, leave a review. If you love it, leave the country, go on vacation somewhere, whatever the case may be. Dr. Ken said it. Going to Tara, I wanted to speak on the 988 initiative. I want Dr. Ken to speak on it from a NAMI perspective, and if you can speak on it from a crisis intervention perspective, and what's the different because it wasn't like it wasn't already out. It's just reformed and retooled into a new different perspective. Talk to me about that.
So I'll start. The policy team at NAMI worked on this while I was writing the book, so I get no credit for this. But the recognition that particularly people of color who call 911 are not getting a mental health response that's appropriate when they have a mental health crisis, right? And I think even with police training and crisis intervention training, I think the idea that there should be a designated mental health number so that people could get a better chance at a thoughtful, culturally responsive, assessment, is 988. So I just want to say, most people would say 911 has not been successful for a lot of people with mental health conditions and a lot of people of color. And people of color with mental health conditions, I'm sure could, do a whole show on that. The movement towards 988 is a step, but it is not complete. Tera's outreach work, a peer specialist, a diverse, perspective that she brings to the table, you can't get that all across America. That's the next step.
Yes, I definitely, I was very excited about the 988 initiative. Here in the state of Georgia, we've had, a Georgia Crisis Access Line for several years now, so we already had that structure in place, but there were so many other states that did not. And so I think that's what made 988 such a great, a great situation is that nationwide now people have access to call a number when they're in a crisis and have someone come out and be able to come out and assess them, to get them the help that they need versus calling law enforcement. One of the things that I would say is what we have seen here in Georgia is since 988 has went into play, our numbers shot up during the pandemic, over 200%. And then when the closer we got to the launch of 988, we were told that the numbers would probably go up over 400%. So now, we have this great initiative, but now we are also struggling with, being able to keep up with the demand, right? Being able to have enough staff to, meet the needs of the people. I'll log in and I'm like, wow, there's 7 calls waiting for someone to respond to, and we only have 4 teams of people on tonight, to respond to all these calls. So it's a start. But one of the things that I would encourage individuals to do is to be patient, because with the launch being so new, this means that there's a lot of people that didn't even, here in Georgia, even though we had the Georgia Crisis Access Line, it wasn't as people didn't know about that like they know about 988. There's been more marketing about 988. So now that the word is out, the demand, has shot up. And so we're going to need some time, to adjust to that, So I would ask people to be patient, um, and to not be upset if they have to wait a certain amount of time, for individuals to get out to you. That's another thing that I try to explain is, when you have a mobile crisis team, you're functioning out of regions. So I might get a call and I might be an hour away from the call. The clinician that I'm going with may only be 30 minutes, but they have to allow for me to get there before we can even start the call. So it's just things like that. I think the more individuals know about how the process works, it kind of helps keep people from being upset. Even with law enforcement, we do still have law enforcement that may have to go with us on calls, depending on what the level of the call is. But the thing that I like about our role is that if we have to call law enforcement, they're going by our lead on what to do. We call the shots. We say, this is what's going on. I always meet them outside and say, okay, this is what's going on with this particular individual. This is what we have. This is what we're looking to do. The reason why you're here is because, maybe this individual is suicidal and they have a firearm in the house, right? So, we explain that to them and they go by our lead. And so that tends to, the people, individuals that we're going to see out in the community, that tends to give them a certain peace, that they see that we're taking the leadership in the role versus law enforcement. They're kind of more in the background when they are having to go with us on calls. And so I just think there's a lot of education that needs to go forth with this initiative, so that people have an understanding on what's happening, and then what the challenges are going to be over the next couple of years until we get it fine tuned.
Man, y'all are offering great stuff. I know we gotta close out, so I'm gonna get your last words. I wanted to ask Tara about the music industry and her experience with that. Dr. Ken, I wanted to ask you about like 50% of like ethnic minorities terminating their therapy prematurely. But again, I want to be respectful of everyone's time. Hopefully we can have you all back in the future in different capacities. But closing remarks, Dr. Kim Duckworth, when we're talking about NAMI, you're not alone. Again, make sure you guys go check it out if you haven't already. Get the book, New York Times bestseller, already off the books, first rate out the gate. I'm hoping I'm in addition to. I'm making a bid now, y'all, to be in addition to when it comes out in the future. Because
there we
again,
go. Love to have your perspective. We're going to need new voices and new perspectives. So, I would say buy the book. It's down to $18 on Amazon. And, they reduced the price 35% because it's selling so well. So that's just capitalism in action. They want to capitalize on the sales of the book. So, I think you'll find the book is written gently and practically, with real people sharing their names and voices and lessons. That's never happened before. And I'm very proud that we pulled this off together. Tera and I and 129 other people, we all did it together. And that's the best way to go forward in life, is together.
And I think that I would add, just in closing remarks, that it was an honor for me to be, selected to be a part of the book. I'm a firm believer that our stories in life are not just for ourselves. Our stories are meant to be shared. The things that we struggle with, the storms that we go through, we can share those with other individuals, and it can help them come out of what they're going through. So I'm a firm believer in the power of our testimonies and our stories. And it shows, this resilience, of the human race. I think that this book is a great example of that. And, I love the fact that we have a piece of work like this that is driven more by, individuals' lived experience. That's something very unique to this book. And I appreciate, Dr. Ken for being a visionary for, work of this sort. So again, if you don't have the book, it's very well rounded. I'm actually having an alumni retreat next week with the alumni here at Skyland. So we have 15 people we're taking out up into the mountains at a lodge. And I bought everyone a copy of the book.
Tara, the book is a bestseller because of you buying the book and in the book. You're unbelievable.
So, but I was so excited when I got the book myself. Again, I think it's a resource that's very much needed for the times that we're in. So I'm excited about it. I hope that those of you that are listening, if you have yourself, if you're struggling with your mental health, or if you have a family member that is, that you go out and get connected with NAMI. We want you to buy the book, but we also want you to get connected as well.
Shout out to everyone that I kind of know in the book: Lorenzo Lewis from the Confess Project,
Love him.
Nick Amy from NAMI, aka NAMI Bucks, NAMI Man,
NAMI Man.
aka. So shout out to some of the people that I have a little personal relationship with, man. And yeah, please get the book. It's a resource, it's support, and I like what Tara said. With like, NAMI is in every city across the country. So please, it's the number one. Again, I'm peer support specialist tonight, so I got to read it. I'm the largest grassroots mental health organization in the in the country. So
Yeah.
please make sure you check out. Just Google it. It should be a NAMI somewhere close by to you. I know it's like 4 or 5 close to me, so I'm sure. Based out of Philadelphia, I'm sure it's one close by you. So check it out. Last but not least, always remember that this platform has never been about being a replacement to therapy. It's an alternative place where people share therapeutic stories. Thank you for listening.
Thanks for having us.